All right.
Hey,
Hey, everyone. We're back with another
girl.
episode of the Chanel Love 22 podcast.
Yes,
My
yes.
blood work bestie, Latoya.
Looking
Latoya.
good, smelling good, feeling good. It's amazing. Looking amazing, feeling amazing,
Right, there you go.
smelling amazing, amazing good. It's the same.
All right. So we have a special guest today, Miss Amber.
Yeah.
Amber Thomas.
Hey.
So today we're gonna tie in functional medicine as it
Hmm.
relates to some challenges that women face, like one of the biggest health challenges that women face
Right.
as it relates to hormones, fertility,
Hmm.
and
Hmm.
also mental health as well. It all is going to tie in together. Let me introduce Amber Thomas,
Yeah.
our special guest today. She's a holistic fertility perinatal nurse specialist
Yeah.
dedicated to helping childbearing women overcome reproductive health challenges and conceive naturally. She has a background as a registered nurse in women's health, and she is an international board certified lactation consultant.
Yeah.
Amber blends modern functional lab testing with ancestral womb wisdom, herbal medicine, and emotional resilience work. Her signature approach addresses root cause of infertility, fibroids, PCOS, hormonal imbalances. She's guiding women to restore harmony in their
Yeah.
cycles, regulate their hormones, and call their babies home.
Call them
She is
home.
the
Come on,
founder of
baby.
Mother's Eve Childbearing Support Services, where she walks with women from preconception to postpartum in a deep, sacred, and evidence informed care. Amber, we are glad you are
Welcome,
here.
Amber.
Thank you. I'm glad to be here. So excited to be joining today. Thanks for having me.
Yes, yes,
Absolutely.
yes. So
Absolutely.
this conversation is so important. We hear about women worried about their baby's health,
Yes,
but
yes,
actually, the health of the baby starts with the mama,
it is.
physically,
Absolutely.
hormonally, emotionally. So all of this is tied into, functional medicine, holistic approach, trying to be sure that you're okay so that you can birth a healthy baby and you all can be okay, right?
Right.
Absolutely. Absolutely. I love that you mentioned the mother's health,
Mhm.
beginning as the foundation for the baby's health. I think sometimes we don't see it that way.
Right.
But that's essential for the growth of the baby, for the wellness of the baby.
Absolutely. And you can't build emotional stability on a physically unstable foundation, right? So, all things working together will create that healthy environment. And I'm talking about mind, body, spirit, gut health, wound health, thyroid, hormones. All those are the foundation that we are trying to build upon to have. Well, Amber, you help them with this so that they can have a healthy pregnancy, healthy baby, and also a healthy postpartum, right? So tell us
Absolutely.
a little bit about what you offer or what you do, Amber.
Yes. So I just help women from beginning to end, from preconception to postpartum, and being healthy and, the process of conceiving, getting pregnant, staying pregnant, and walking them throughout that entire journey. And so I provide
Right.
some coaching services on wellness and health for basically for women's health during that perinatal period.
Right, right. And that's what I absolutely love about Amber. I mean, did you hear that? Getting pregnant, staying pregnant, right? Getting pregnant and staying pregnant, because you have a lot of women, some women that can get pregnant, can't stay pregnant, right? You have some women who have difficulty and challenges with actually getting pregnant. And I have to put this out there before we get started, just because this is just so exciting to me. I've actually consulted with Amber on a client. Okay. Yes,
Mhm.
I'm a nurse practitioner. Yes, she's a registered nurse and she has international board certification as a lactation consultant specialist. But Amber is the ish when it comes down to Really, when it comes down to, because as nurse practitioners, we have to give our flowers to every healthcare professional we work with. And I was having some challenges with the client because they were displaying some symptoms that I had not really dealt with on that level. And as I'm like, hey, this is what's going on, Amber's like, bloop. I'm like, what? You know, Amber's just like, she went right to it because this is her niche. This is her jam. This is what she does. Okay.
Right,
So
right.
that client was so grateful, Amber. I don't know if she was so grateful. And honestly, when I went back to her, I sound real smart because Amber kind of helped me to see what really could be the root cause of what was happening with her, and she was so grateful. So Amber has a lot of really good information to give us today, so I'm super excited about today. I'm really excited.
Thank you for
Yeah.
sharing that, Latoya. It was good to just be able to help and collaborate and us
Yeah.
work together in
Right.
helping our clients and our families who are struggling with a lot of ailments and illnesses
Mm-hmm.
and things that they just have no idea what's going on. And so for us to be able to provide that
Yes.
education and support is essential. So
Yeah, it
that's
is.
why
Yeah.
I'm very passionate about my work. One of the things that motivated me to really focus on fertility and fertility support and pregnancy is that you all may be aware that our infant and maternal mortality rates in the
Mm-hmm.
United States are outrageous. We have the highest rate of maternal and infant mortality. And this is just meaning that moms and babies, Black moms and babies,
Mm-hmm.
are dying at faster rates than any other country upon childbirth. And so I looked at those outcomes and wanted to trace it back. Let's go back to the root. Like, how did we get here? How
Right.
did we get here to where our moms and babies are dying
Right.
during childbirth, during that whole process? So what's going on? What's going on with the root cause? And so that's something that I've become very passionate about. And one of the things that I've picked up in the
Yeah.
research is just the chronic stress that women deal with, especially Black
Mm.
women, just generally before
Yeah.
pregnancy, during pregnancy, after pregnancy. Our bodies are stressed. And you'll see on the research, Black women,
Mm-hmm.
highest rates for
Mm-hmm.
heart
Mm-hmm.
disease, highest rates for
Mm-hmm.
breast
Mm-hmm.
cancer,
Mm-hmm.
highest rate for death, So why is it that we are showing up number one for these terrible outcomes, right? How do we trace that back? So you'll see,
Mm-hmm.
some theories in the research that say, oh, Black women don't eat well, or Black women aren't educated, or all these things, right? But let's think about somebody like Serena Williams. Let's think
Yeah.
about somebody like Beyonce. So Serena Williams is an athlete, pure athlete. So we
Mm-hmm.
can't use diet and exercise on someone like her, right? We can't
Right.
use socioeconomic status on someone like her. So she had an experience where she nearly died after having her baby due to postpartum hemorrhaging that wasn't picked up on after her delivery, after she complained multiple times.
Oh.
So where does this come from? Where does this come from? So the research is showing chronic stress and also some forms of discrimination. But how do we help ourselves? How do we heal ourselves so that we can create a healthy foundation for ourselves and our babies?
Oh my gosh. Oh, Amber, I never
Deep
knew that.
question. That's a deep
Oh
question,
my
and I'm so glad
God.
you brought that up, Amber. That is absolutely a statistic that is heartbreaking to hear, and it absolutely is connected to being in within the African American community, and that is something that a lot of people now are researching home births. They're wanting doulas. They're trying to do more
Yeah.
natural things
Yeah.
versus the traditional way that we normally um, have babies. Or I actually, you know what, before even knowing those statistics, of course I'm a mother, but I started to hear a lot of younger um mothers getting a C-section. Like everybody was C-section,
Mhm.
C-section, C-section. I'm like,
Yeah.
why everybody having a that was like
Yeah.
my I didn't want that when I
Mhm.
gave birth. Like that was my fear of like having to have a C-section. And it seems like is more common now, and more
Very.
people are, having that done than having
Yeah.
natural vaginal birth, especially when they go to the hospital to have their baby. And now they're even scheduling these
Yeah.
C-sections,
Oh yeah.
so
Oh
yeah.
yeah.
Yeah,
Yeah. And
you bring
it's
up a
not
good
even.
point. Mhm.
Mm-hmm.
It's, you talked about being a nurse practitioner and being a nurse, and you talked about being a midwife and doctor. So every practitioner or provider kind of has their place, right? Of
Mm-hmm.
how they can help.
Mm-hmm.
Doctors, especially OBGYN doctors, are really trained in surgery, right? And they're trained in medical issues and medical problems. It's really problem based. They're
Yeah.
trained to be able to handle emergencies and things that could go wrong during a delivery.
Mm-hmm.
So we need them. We need doctors for that. But
Yes.
for a healthy pregnancy, a non-complicated pregnancy, which around 88% of the population has a relatively uncomplicated pregnancy, the recommendation is to deliver with a midwife. And
Mhm.
so this is a type of pregnancy where there's not a lot of health issues on board to begin with. There's not a lot of risk factors on board to begin with. And so
Mm-hmm.
you may not need to see an OBGYN for your pregnancy. A midwife can provide the care for the entire pregnancy as well as the delivery for an uncomplicated pregnancy. C-sections have become a matter of convenience because they
Mhm.
can be scheduled, they can be timed, versus allowing a woman to naturally labor however long it takes for her body to deliver the baby, because the woman is the one who delivers the baby. The doctor or the
Right.
midwife, we use the term catch the baby.
Yes. Yes.
Because whether there's a doctor there or a midwife or a hospital there or not, that baby is coming, right?
Right.
Coming,
And
right.
Right.
so sometimes we need intervention. And when we need intervention, that's where hospitals and doctors come about. I actually had my baby with a midwife at a birthing center in a birthing tub. My baby weighed 9 pounds, 1 ounce, was born
Wow.
vaginally, naturally, unmedicated, no problems. But the key to being able to do that goes back to that healthy foundation. What
Yes.
is the womb health? What is the
Yes.
mental health? What is
Yes.
the spiritual health? What is the psychological health? So I like
Right.
to think of like a table. Table has like 4 stands on it, right? If
Mm-hmm.
we knock out one of those stands, what's going to happen? We talked about hormonal balance, right? Let's talk
Mm-hmm.
about balance. If we
Right.
knock off one of those stands on the table, what's going to happen to the table?
It's gonna tip over.
It's going
Imbalance,
to tip
baby.
over.
Don't
It
put a
cannot
cup of water on it.
stand properly. It
Yes.
cannot be balanced with even just one of them knocked out, right?
Right,
Mm-hmm.
right.
We need all 4 of those support. We need the mental support, the spiritual support, the physical support, the emotional
Yes.
support. Um,
Yes.
that's what those stands do for that table. They support it, they hold it up so that it can stand and balance properly. So when a woman is not fully supported in either of those areas,
Yes.
she's now out of balance,
Wow.
right?
And that's so. Oh, go ahead. Go ahead, girl. Go ahead. You're preaching. You're
You
preaching.
go ahead.
I mean, it's because when you think about it like that, as a woman, right, as a minority woman, as a woman who's faced many pressures, and even someone who's very professional, they seem like they have their life together, they have their home, they have their vehicles, they could be a single mother. You have a lot of single mothers, right? And when you think about the fact that those people, because I was one of those people, you see yourself as thriving, you're doing well, your finances are together, your children are healthy somewhat, but you're not even considering the fact that you're internalizing stress, that your body's still
Mhm.
experiencing it.
Right.
Although you may be feeling okay, your body is still imbalanced because you are off balance. As you said, one of those legs, spiritually, you're off balance, right?
Mhm,
Or
mhm,
physically, you're off balance in some way, but you feel okay. You might be
mhm.
tired, but you're going to get up and grind. You hear a lot of
Mhm.
people say that I'm tired. I got to leave this bed. I got to let the bed go. You're off balance if you are not able
Mhm.
to really get out of your bed, get your day started. But we don't think about it like that. We think that we're
You're off
grinding.
balance and you don't
Wow.
even know it. And it's not
Wow.
even just what's happening in the current moment. But all those things that has happened in childhood and
Prior.
leading
Yes.
up to this
Prior.
moment, if you have not dealt with the trauma of those things, then those things are stored in your body. They're stored in your hips. They're stored in your shoulder. All those areas where you have pain, you have unhealed, unprocessed trauma stored there, and those things are going to affect you. As you know, a lot of women in general, but Black women in particular, are just plagued by disease and disorders and ailments every day. And some of the most common ones that I deal with are going to be fibroids, endometriosis, PCOS, thyroid disorders. These are all hormonal imbalances because women go through so many hormonal changes, and stress impacts those hormones. And so when we just, we tend to just go, 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 go. And I am 100% guilty of that. We just go. We just go. We just do what we got to do. We're just in survival mode. We're trying to get it. We're trying to take care of our kids, take care of everybody that needs to be taken care of, except for who?
Ourselves.
Who's left on the back burner?
And we think that's good. Who taught us that self-sacrifice? I mean, at some point, I understand if you really have your mental health together, if you have your physical health together in your body, and then your finances are together, and then your children are healthy, then your husband is happy, or you're a man and your wife is happy. Okay, that but for you to really think that you have everything together because you have certain things financially, right? You really don't. What was just so amazing to me when you were talking about storing stress in the body, and that's where pain is, that's where discomfort is. There are so many people that I see with pain, and again, doctors can't figure out why you have this pain. So that's when we get the fibromyalgias and the chronic pain syndromes, because maybe they had an injury. I talk about it in my book Against All Odds. That was one of the main things that happened with me in a really bad car accident, right? So then it's like, why am I still having this pain? They're like, oh, you shouldn't have this pain if your lab results are slightly abnormal, right? So you shouldn't be feeling the way that you feel. But I'm like, but why am I debilitated? Like, you're gonna have to give me a rollator after a while. And it's because I was in grad school. I was raising 3 children by myself. I was driving an hour and a half, 2 hours to get to class, then another 2 hours to clinical. I was up at 5 a.m. getting them ready, getting them. That was all stress on my body, and it was just lingering. It was sitting there. So the areas of injury were becoming more and more inflamed until I had to learn how to breathe through it, which introduced me to root causes and breathing well and all of that. So Amber, can you tell us a little bit more about like the body, the woman's body, whenever she's trying to get pregnant and she's experiencing stress? How does that like oppose her ability to become pregnant?
Hold on. Before you say that, though, Amber,
Okay.
sorry. I just want to throw this in here because it kind of goes with what Latoya just said. Latoya, you talked about a physical injury. Amber kind of touched on it, but don't forget the mental injuries, the
Ooh.
mental trauma and the mental things that you go through, whether it's childhood or adulthood. Like Amber said, it's stored in your body, it's stored in your womb. So miscarriages, traumatic
Yeah.
situations,
Right.
abuse, all those things are stored within. And
Right.
Amber
That's
said
true.
it spiritually. Becoming pregnant or being pregnant is a spiritual thing. This is our portal as women. We bring
Yeah.
life here, so it's
Right.
very spiritual. It's very spiritual. And that's
Mm,
why from the
that's true.
holistic approach, then it's from the holistic approach of functional medicine, how we touch on every part of the person
Yeah.
is what gets them to that level of being ready to, I think, carry and develop a healthy baby, like Amber was
Yeah.
saying. I just wanted to throw that in there. That it doesn't always have to be physical.
That's
It
true.
can be mental
That's
trauma.
true.
I'm sorry. So go
That's
ahead,
true.
Amber.
Yeah.
Absolutely. I like to think of it like a garden. Now I don't have very much of a green thumb right now, but I'm working on it.
Me too,
Okay.
girl.
But I like to think of it as a garden, right? We are wanting to plant in fertile soil so that we can have a harvest, right? So if we are planting seeds in toxic soil, we're not going to have a harvest. If we are growing a baby in a toxic environment, we are not going to be able to grow a baby. So the environment is your body.
Your
And
body.
so
Yep.
your mind, your body, your womb, your spirit, that is the environment. So we need to dive in personally and see what's going on with your soil, right? What's going on with your
Ooh.
environment? What's the root cause?
Damn.
What are your roots looking like? What is your
Right.
fertilization
Right.
looking like?
What's
We
your
need to
fertile?
look at that before we even ever think about becoming pregnant,
Ooh.
right? So
And that, yes, absolutely.
You just delivered
I
Absolutely.
some people,
offer
Amber. You just
root
delivered
cause
some people.
blood work analysis
Ooh.
to look at you and what's going on with your soil
What's
and
going
what
on with your soil?
hormones are out of balance, what vitamin deficiencies, what nutrient deficiencies do you have. So how can we start fertilizing that soil? How can we get some compost added
Oh.
to that soil? How can we make this soil more
Rich.
healthy, more fertile,
Yes.
more
Right.
rich, so that
Rich.
we can harvest and grow
Yes.
a healthy baby, right?
Mhm.
So to
Ah.
answer your question, Latoya, that's where it starts. And unfortunately, um, most women are not getting the support that they need in that realm because there are these standard protocols, these one size fits all. And
Yeah.
sometimes we need a more customized approach where we can look
Right.
at the individual, because what works for one person obviously may not work for another person, right?
Mhm.
And so sometimes, because doctors are trained to look at problems and fix problems, sometimes some of these um, foundational things get
Mhm.
missed because
Right.
we're jumping straight into, okay, let's do surgery, let's do in vitro, let's give you a hardcore medicine to get you pregnant, and we missed the foundational pieces. Are you getting enough sleep? Are you well hydrated? Are you well
Right.
nourished? Are
No.
you getting good movement in?
No.
What's your spiritual status like? Have
Oh.
you dealt with trauma? Are you meeting with a therapist or a psychologist or someone that can help you with your mental?
Mental.
Can
Yes.
we get back there? And so a
Yes.
lot of women are fed up with their care because they are going to the doctors for help. They're looking for help to get pregnant. And
Yeah.
somehow we are missing the mark. And so,
Mm.
fortunately, a lot of people are turning to holistic and functional medicine or other alternatives because
Mm.
they're realizing that it's not working. They're not getting anywhere. And like you mentioned earlier, Latoya, the doctor will tell them your labs look great, but you're
Mhm.
like, I don't feel great. And I
Mhm.
can say that even for my own personal testimony.
Wow.
I was on that go, 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 just like you,
Mhm.
Latoya. I was a single mom up until
Mhm.
my daughter was 12 years old. She's now 17. I'm now married, but that 12, 13 years as a single mom was go, go,
Yeah.
go, go. I was in nursing school. I was building a business. I
Yeah.
was taking care of 30 plus clients at a time. I was training and mentoring other people to do what I do and make copies of myself.
Mhm.
I was
Mhm.
doing a lot. And I look
Oh
back
yeah.
on that time like, how
Yes.
did I do this?
Exactly.
And all of a sudden, I started gaining weight. I
Mhm.
started feeling depressed. I started feeling anxious. And I started having all these symptoms. And I went to a doctor who told me that I had stress induced low thyroid function. What is that?
Mhm.
Mhm.
He said, Amber, it's like you're running from a tiger every day.
Yep.
Your all of your hormones are depleted, but your cortisol is up here. And he's like, it's like you're just operating on no fuel. You just go, go,
Yes.
go, go,
Just
go. So it
going.
wasn't until I started having symptoms and problems, like most
Yeah.
of us, something
Right.
has to happen in our body to get our
For us to
attention to
go.
say,
For us to go.
okay,
Right.
For us to go.
something's wrong, right?
Right.
And then
Right.
I started working on my thyroid with the doctor. And of course, they wanted to do medicine and they wanted to take my thyroid out because I had a
Mhm.
nodule, a goiter. So you know me, I wasn't going that route because I'm already just naturally holistic. So I had to really look for doctors who would work with me and take me back to, well, Amber, are you getting enough sleep? Are you, all those
Yeah.
foundational things? And
Yes.
I've been able to heal my thyroid naturally.
Oh my
Just, it
gosh.
took some time. Took some time. It's not an
Yes.
overnight pill, but
Yes.
I've been able to heal
Right.
my thyroid. And I went back to that doctor who tried to do surgery. And I
Yeah.
asked her so many questions. How do you shrink this? How do you do this? How did this happen? How did it get here? She said, oh, it's genetic. And I said, but
Mm.
I'm a nurse and I've looked at all my family's lab work and I didn't see anything. I'm the only one who has it. She said, yeah, it's probably somewhere down the line and you missed it. I said, okay.
Mm.
And so is there any way to shrink this? Is how do we deal with this? Oh, we'll just watch it and when it's ready, we'll take it out. So she just had me coming back every year until she could remove my thyroid. Until one day I came back and she said, where's your nodule? What have you been doing? I said, oh,
Healing.
nothing, just applying some frankincense oil and some castor oil packs. And I changed my diet a little bit and checked my labs. And she was like, I've never seen it before. Right. And
Mm.
so it's just going back to the basics and realizing that we are just running on fuel. We're not really taking care of ourselves. And so being
Mhm.
intentional about taking care of ourselves and
Right.
restoring balance.
Intentional. You just said so many
Yes.
golden nuggets.
Yes.
Oh my God.
Yes.
So many
Absolutely.
nuggets in
Look,
there.
I want to go back to fertilizing the soil
Girl, what that
Yes.
because that made me think of gut health.
Mm-hmm.
Your
Yes.
gut health
Mm-hmm.
affects womb health. It's right there.
Mm-hmm.
So
Yes.
if your gut health is like, it affects everything else, of course, you know what I'm saying? But
Mm-hmm.
it's directly above your womb. So
Yes.
people have, of course, we hear the term leaky gut, but
Mm-hmm.
literally your gut health affects your womb. So when she was talking about that, that made me think about, oh my God, like
Mm-hmm.
gut health, the
Mm-hmm.
foundation of trying to
Yes.
fertilize your soil. Yes,
Exactly.
absolutely.
Exactly. And it was just so amazing. You talking about the things that we learn, the foundational principles, right? We learn them whether you're a registered nurse, whether you're a provider of any sort of PA, a nurse practitioner, physician. We all go through those foundational principles. But how much time do
Yes.
we spend in school on how to properly teach someone how to breathe, how to practice it yourself so you can teach someone else? We don't get into a lot of that. It just says, hey, these are a few things you can do. You can teach my deep breathe, guided imagery, music, it's like
Right,
real
right.
quick. And then you're going to
Mhm.
get into the disease management piece of it, understanding disease because our country is so plagued by it. But going back to those foundational principles, and trusting that, right? Trusting your experience, knowing your body, Amber, when you were experiencing that and then doing it safely. And that's what I love about us coming together, just, as a holistic family, being safe. The things that you did were safe. You have a lot of people who are taking oils, taking supplements. They have no idea how it's going to respond in their body. They have these diagnoses. You hear it a lot when people go get any type of cosmetic surgery. They hide their
Right.
diagnoses. They hide it. And so
Mhm.
you're listening to someone telling you they took one supplement, you want to go take it, and it responds differently in your body. That's considered
Mhm.
unsafe. You need someone who has experience, who has the knowledge base that can guide you in this process, consult you in this process on the best steps to take, which is what Amber did and was able to get natural healing results, and even surprised the very physician who wanted to remove the organ. So it's like, where'd that
Mhm.
go? I was looking forward to cutting
Mhm.
that sucker out. And it's not
Right.
there. Like I have nothing to cut out now.
Right, right,
So
Yes.
right.
that was just an amazing, amazing holistic healing story. I'm telling you, just a bio. It's really your life, right? And how you were
Yes.
able to dive in this completely. I'm telling you, it's so much motivation in that. And again, going back to that, going. You don't realize your thyroid is just like boom, boom, boom.
Like,
Hold on,
hello,
I'm
hello.
being burnt
'Cause
out.
I put so much pressure on the thyroid. It's
Yes.
responsible for so many processes, and I had pretty much burnt it out. And
You
then
drove that
I
car to
was
E.
burnt out. I
Yes.
was literally feeling
Right.
burnt out. So
Yes.
I love what you said, Latoya, about that because one thing is that I didn't do it alone. I had a functional medicine doctor. I
Yeah.
had a coach. I
Yeah.
Mhm.
had to have somebody, even though I'm a nurse,
Right.
I had to have that accountability.
Yes.
I always do better when I'm in some
Yes.
kind of program because
Yes.
Mhm.
I need that accountability, or the default Amber is going to come in, which is that
Oh
go,
yeah.
go, 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 Amber. And
Because
we're
you
going
Right,
to
been there
forget
right.
longer.
all that we're supposed to be doing because
Yeah.
one little thing triggered me or one little thing happened. And now it set me off and I'm
Yeah.
back to that. Let's get it done, go
Yeah.
getter mode, and then
Yes.
forgot about all the stuff I'm supposed to be doing. So I
Yes.
really encourage people, we think we can do it by ourselves, especially us as women, and
Yes.
especially Black women. It's like, I'm independent, I got this, I don't need
We can do it.
nobody. But
Yeah.
Right.
Latoya, you mentioned something really important, and that's just taking random oils and supplements and herbs,
Yeah.
right?
Yeah.
This is a big problem. And
Yes.
this is where I really pride myself on customizing the experience,
Yes.
because we
Yeah.
really,
Absolutely.
root cause blood work analysis allows us to really be able to take a deep dive into specifically what's out of balance for you.
You.
You're going to Walmart and taking some vitamin
Yes.
D supplements because somebody told you vitamin D is good for
There
you.
you go.
Okay, good. You're going here and you're taking vitamin C, you're taking all this stuff, but
Mm.
you could be taking that and that actual vitamin is already imbalanced. So now you're putting yourself into toxicity because now you have too much of that
Come
vitamin.
on.
So
Somebody
we
said it.
actually
Yes,
need to
Somebody said
absolutely.
it. Uh-huh.
look at what's out of balance specifically for
So you'll
you.
know
Then we can make the proper recommendations,
on
because
what you need to take.
between me and Tawana and Latoya, we all are
Mm-hmm.
going to have our root causes are all going to look different. We're all going to have
Mm-hmm.
different balance
Yeah.
imbalances.
Mm-hmm.
So
Right.
Right.
Latoya goes and gets some vitamin D and like, here, Amber, here, sweet tea, we
Take
got
it,
some vitamin
girl.
D.
Take it.
Right.
And I think it's just we have this kind of mental thing of like, okay, I can figure this out myself. And at the
Mm-hmm.
end of the day, you're wasting money, you're wasting
Yes.
time. I can relate because I tried
Hell.
that too. And
Mm-hmm.
Mhm.
I can't tell you how much hundreds of dollars I've spent with the doctor, going paying for the appointments, paying for the medicine, paying for this. If I
Yes.
At least 7 years of
Wow.
doing that. If
Mhm.
you add that all up, and then when I went to my functional medicine doctor, in 2 years, my thyroid was healed. And if I compare what I paid in 7 years versus
Mm.
what I paid in 2 years with my functional medicine doctor, I spent way less time and way less money over here.
Yep. And
So
it was more
sometimes we can
direct.
be
Yes.
intimidated by,
Mm-hmm.
oh, I don't want to pay for coaching, I don't want to pay for this. But otherwise, you're just throwing money away, you're throwing time away. And
Yes.
like you said, Latoya, you're possibly harming yourself
Yes.
by not putting the right things in your body. And not all
Mm-hmm.
supplements and herbs and oils are equal. So you need the
Yes.
proper
Exactly.
recommendation on
Exactly.
what's
Right.
clean and what's good
And
for
what's
you.
good for your body. Because I'm telling you something. If somebody come to my house uninvited, like let's say I'm going through something, I'm going to equate me to a body. Okay. If I'm going through something, I'm already angry, or any human, and you already feeling like a high emotion, whether you're preparing to cry, you're really sad, you're angry, and you come and tell me something I don't want to hear, or you're giving me something I don't need, it's going to build that emotion. It's going to make it 100 times higher. It's the same way with your body. If your body does not need a supplement, it is already off balance. It's already angry. It's already raging. Hormones are racing everywhere. Your cells not letting anything come in. Your body is just in distress, and you're going to go take a random supplement because somebody told you to, and you read something in a group that's not trusted. You need to come to the elevation room. Anyway, you read something in there that was not trusted. And so now you taking it, your body like, what in the world? So it's accelerating even more. It's breaking even more. And they like, I started taking this and I feel worse. That's why you feel worse,
Yes.
babe, because your
Yes.
body said, why did you do this to me?
Yeah, and Amber
Exactly.
brought up a good point. Amber, you brought up a good point about people doing their own research and trying to do this on their own. What about the quality? of what they're taking. So you might get a recommendation for someone to take this supplement or do this or do that. It's not working. The quality, like you hear people going to like the local stores and grabbing a vitamin D or a iron supplement, whatever. It's not the proper one that you need for yourself. So like Amber said,
Yes.
it's all individualized, all customized.
Individualized.
And sometimes they're having a reaction to a filler inside of the supplement. And that thing is inflammatory for that person. And so then it makes their problem worse.
Right.
And sometimes you may not need a supplement. I have helped women just by removing certain things from their lifestyle that they had no idea was affecting them. And so this is again where that personalized, customized approach comes in. I had a client, she had, oh my goodness, she had a whole shelf of designer perfume. I was probably looking at a good $5,000 worth of perfume on her shelf. And she prided herself on her perfume. She loved her perfume and she always smelled good. Yeah. But that was the first thing I had to remove when we started to working together. Wow. That alone, before we ever talked about supplements, we did an assessment on what's going on in your environment, right? Because let's go back to that soil. What environment are we planting the seed in, the soil in? Right. Yeah. You know, you can have a backyard in Texas and try to grow a garden. You can have a backyard in Atlanta and try to grow a garden, right? Yeah. What is the soil? What is the condition? Because it is hot in Texas. Hot in Texas where I am. So what's that environment like, right? So by putting all this perfume on, she didn't realize that the perfume, the fragrance, the chemicals in the perfume are hormone disruptors. They are hormone disruptors. And so, and she would put it on daily, heavily. Am I going to take her all her perfume away? No, but let's talk about, can we replace it with some cleaner perfumes? Can we replace it with some floral scents or some roses or some lemon, something like, can natural we use oils natural? So we started using some essential oil blends and she fell in love with them. But the essential oils, some of them are antibacterial, anti-inflammatory, antifungal. So now we're actually putting good things into the soil, good things into the environment versus toxic things. So we had to remove some perfumes, the type of makeup that she was wearing. We talked about, are you using plastic, a lot of plastic water bottles or a lot of plastic dishes? Are you cooking with Teflon? Like, what's your cookware look like? Are you using a microwave? What's your radiation exposure? So those things alone, just looking at that, you know, taking that stuff out. I have a lot of women with PCOS who are very sensitive to those type of environmental hormone disruptors. And a lot of times just removing those things alone and replacing some of their household products, cleaning products with healthier, more organic, cleaner products. Sometimes that alone, they got pregnant.
And you see, so, my uterus is jumping right now, even though Amber's going to take away all my perfume, you know?
No more Bath and Body Works.
It's so much that we do, though, guys. Like in the African American home, like we don't understand. There are things that we do. We clean with our cleaning.
Let me tell you something.
Stuff we put on our smell good. It's like
did it this morning.
People bathing in bleach. Like we are doing things that was passed down. Yeah, you know, and we didn't have that knowledge. So now it's kind of. I mean, some people are like, okay, hold on, wait a minute, that does what? Okay, there's an alternative. Let me try that. And some people are just stuck in like, nah, this was grandma did. This didn't work in. This is, but and they don't understand that how that affects their health, like literally. So I'm glad you mentioned that.
Wow.
Yes, very true. I try to use things that are very natural. So for my skincare, which I get lots of compliments on my skin, but
it is cute, girl. It is
for my skincare, I use things like shea butter, coconut oil, olive oil, and then I just mix in some essential oils with it if I need to. But I try to stick with the very, you know, basic things that you can find in the kitchen. And so I talk to my clients about these simple things that can change them, can change their hormonal profile. I have a couple clients who are addicted to coffee and the caffeine, and they're just constantly at Starbucks. So sometimes we have to remove, or let's not say remove, because that can be intimidating, replace
Right.
that
Replace. Yeah.
need with something else that can be that
Yeah.
can really serve your body. So I try to teach my clients, let's not focus on all the things we have to take away. Let's focus on what serves your body. Is this
I love
perfume
that.
really serving your
I love
body?
that.
Is this
I love that.
makeup serving you?
Oh,
Is
wow.
this caffeine? How is it serving you? Yes, it's serving you. It's giving you energy. What are some other ways we can give you energy? So I recommend ginseng shots as a
Yeah.
replacement for the caffeine. So there's just so many things that we can look at before we actually get into, is there a supplement, herb, oil, or medication that's needed? We need to get things in balance, better yet, in harmony first.
Right. Right. It's
I
a
love it.
lifestyle change. It's absolutely
I
a
love it.
lifestyle change.
I love
Everything ties to your health, things that you do on a day-to-day basis, the food
Right.
you eat, the movement you make, just all your choices, all of that ties into your health. And I appreciate you, Amber, for taking
Bringing it
time with
up.
your clients to even educate them on that, because that's something you don't get. That's something you get from a functional medicine provider such as yourself, or someone who specializes in the holistic approach of doing things, even when it comes to fertility, Latoya, thyroid, me, mental health, like just having someone who is a provider who understands that there is a more natural way to do things, and that your environment and the things you do on a daily basis affect your health. So no
Wow.
matter how much I'm telling you, like, these are the things that contribute to your situation, that your condition that you're in, you have to make those changes yourself. Like,
Right.
Yeah.
you have to be
That
present,
part.
and you have to be willing to make these changes yourself. So
That part.
your client Amber probably seen results when she took what you said to heart and did the work, right? I'm sure.
Yes, yes,
Yeah.
absolutely. Over time, and it's just like when if a doctor prescribes medicine, if you don't take it, you may not necessarily feel better based on what it is. But yes, I'll be giving recommendations and assessments and maybe some protocols to help get things in balance. At the end of the day, everything is up to you. Just like with me for my thyroid, I went to several doctors, paid lots of money, spent lots of time. At the end of the day, no one was able to help me but me. So I truly believe in being your own healer.
Yes.
You have
Take
to
charge
take
of your
charge
own
of your
health.
health
Yes.
and
Absolutely.
become your own healer, right?
Yes.
I'm not here to heal you. I'm here to help you heal. Let's heal together. I'm still
Right.
healing. I'm
Right.
still working on things. I actually recently found out that I have a diagnosis of endometriosis in a very small 1 centimeter fibroid myself. But I feel so empowered because I don't feel like, oh, let me rush off to this OBGYN to do surgery and clear out the
Right.
endometriosis. I
That's
feel like,
Right.
I know how this
Right.
got here. Just like I told you years ago when I was hustling and bustling and I was not taking care of myself. Now I am. There's some consequences that I'm dealing with as a result of that. But because of my education and my experience and my research, I feel empowered that, okay, endometriosis, I got you.
Know what
I
to do
know how
with
to
you.
fix this. Amber,
Know what to do
some
with
things
you.
you need.
Right.
Take.
Right.
Yeah. There's
Yeah.
some things you need to take. And I'll do a root cause blood work analysis on myself and see
Myself.
what's out of balance and
Right.
see what I need to
Absolutely.
restore. And thankfully, it's a very mild version. So I'm thankful for that. But I'm not thinking like, oh my gosh, when we get these diagnoses, we get really intimidated. But endometriosis, PCOS, fibroids, these are imbalances related to inflammation. These are imbalances related to excess estrogen in our bodies.
Yep.
These are things that we have the power.
Yes.
You have the power to fix and change and correct and heal. And some of these things, this inflammation goes back to that emotional trauma, storing those things.
Yeah.
And so when I'm dealing with myself, I'm dealing with myself from the mind, body, and soul aspect.
Mhm.
Me personally, I'm not trying to get pregnant, but I don't want endometriosis just flying around in my uterus either, right?
Right. Right.
And
Right,
so the
right.
same things that I use to help my clients, I use for myself. So we are literally healing
Yes.
together. I'm going to give you the recommendations. I'm going to look at what's personally going on with you and what's out of balance. And then at the end of the day, it's up to you to heal yourself and to get
Right.
these things in balance. And it's so empowering because you don't have to rely on someone else to give you a pill or a medicine or a shot
Or
to heal
surgery.
you because
Or
or
surgery.
Or
surgery.
surgery.
Yes. Because at the end of the day, you can have a surgery for fibroids. Guess what? If
Mhm.
you didn't address the root cause, it's
It's
coming
coming
back.
back.
Coming back
Right?
Coming back.
around. My grandma said, what goes around comes around. It's coming back around. It is coming back around. And Amber, let me tell you something. You have served me today. Okay. I'm sitting over here quiet, like, what did I clean with today? What perfumes do I have? Like, I'm going through everything in my mind now
Uh-huh.
because we all have our specialty, right? But it's so good to hear from different specialties and different perspectives, because even as Amber said, as T has said plenty of times, when you are in your specialty still, it does not mean that things are not going to come up for you, right? It's just,
Right.
how are you going to deal with it? And it's
Mhm.
so good for people to hear that you actually have the power to make that change. The power
Yeah.
is not in, oh, I go see the doctor at the big research hospital. Oh, I go over here and see this doctor over here at the small hospital. I go see the ones who number one in cancer care. That's all
Mhm.
amazing, as you should seek out the best possible care. But ultimately, that treatment plan is in your hands. You have to show up for whatever it is. You have to
Yeah.
go, you have to be present, and you have to make a decision, a conscious decision to do the work. And unfortunately, for some of us, we wait until we feel the symptom, until we have something going on before we're going to present ourselves to someone. But
Yeah.
ultimately, the power is in your hands. What are you going to do about it? So you have PCOS. What are you going to do about it? You're having infertility issue. What are you going to do about it? Right? Are you going to keep
Right.
scrolling and trying to figure out the next greatest supplement, the next greatest diet for you? I mean, Amber just dropped so much gold here today,
Yes.
to the point where
Yes.
I'm even reconsidering my whole life. Okay. So
What I Yes, what I like about functional medicine though, like when you do go to get a root cause blood work analysis, is that you have a provider or a specialist who has taken the step further to get further educated. So it's not just here's a medicine, here's a protocol, everybody fit into a box like Amber said. It's no, let's look at you individually, and that is why Amber still has her thyroid today.
yes. Hey, Amber Thyroid.
Amber still
Yes.
I'm so happy for that, because do you know how many
Yes.
people I
When it
know
got
who
cut
don't
out.
have their thought? Yes. And then
Yes.
if you were to even mention like, hey, there's a natural way you can everybody's not even aware that that is something that can be done, because it's
Not
so
trusted.
common to have the in the box treatment, the surgery, the what do they call it when they shrink the nodules, whatever that procedure is, when they go in and do the instead of doing the surgery, there's another procedure that they do besides that. But
Embolization.
yes, but Amber took another approach to it. Like, she's like, I'm taking charge. I'm finding there is something that I can do naturally. And she followed through. Like you said, all those years of trying to figure it out and spending money and doing it yourself, when you decided to invest in a functional medicine provider and got the right answers, you were already invested in what you were doing. You just needed direction.
Just
You
needed
just
direction.
needed direction.
Absolutely. I
Needed
just needed
direction.
some guidance. And
Yes.
after overcoming the thyroid issue, this just goes back to that empowerment, because now when the endometriosis issue came up, I'm like, oh, I healed my
Yes.
thyroid. I got this,
Right. Right.
That's such a good place to be in. And
Right.
I'm telling you, 10 years ago, that was not the case. Although I was holistic myself, I didn't know all of this. I knew about helping women with pregnancy, labor, birth, and breastfeeding. I didn't know how to heal my thyroid. And so it's just empowering as you learn layer upon layer upon layer of healing.
Yeah.
And so I want to also focus on something you said, Latoya, something you were talking about that kind of sparked a memory for me. Sometimes you may need a non-holistic approach. Sometimes you may need surgery. Sometimes you may need a doctor. But the two models do not have to exist separately. They can go together. And so I would say start with the foundation, start with the holistic care. But if there's something going on with you and you need surgery, you need a doctor, get that help along with continuing to balance the foundation.
Amber?
For example, I have a client who, yes.
Okay.
Go ahead.
I think she's
We
just
good?
freezing up a little bit. You're just lagging a little bit, but I can hear you now.
Yeah, we
Can
can
y'all
hear you.
hear
Keep
me?
going. Uh-huh.
Yeah.
Can you hear me? Okay. So for example, I have a client who was diagnosed with stage 3 breast cancer. She obviously needs a doctor and she needs other treatment, right? But I'm going to walk alongside her and still look at her root cause blood work analysis, look at what hormones are out of balance. How did this cancer get here in the first place? What inflammation caused this? A lot of cancers are estrogen based. And so especially breast cancer, right? And so what hormones are out of balance that we can still look at while she's getting the treatment and the care that she needs. And because she has this fear of dying now, we now need to deal with that fear because that fear is going to be processed into her body. And so one of the modalities that I use to help deal with the mental, emotional, and spiritual aspect of things is something called brain tap. And brain tap is it's a neuro-emotional technology that helps to regulate the nervous system. And so when I was in nurse burnout, and I was seeing a therapist, talk therapy just was not enough for me. I consider myself very intelligent and I have a lot of insight on what's going on with me. And so as the therapist is repeating things back to me, I'm like, yeah, I know that. How do I fix it? This is what I've tried, you know? And so she just kept saying, Amber, you're just dysregulated. You're just, yes, I know. How do I fix it? You know, how do I get regulated? I mean, because I was yelling at people and I was irritable and I was in burnout. And so I found Brain Tap, and it's a headset that has LED lights on it, and it's connected to an app, and it has all these like, you kind of like the Calm app, like meditation, frequencies, vibrations, brain waves. And so you click on the one, you can go on the app and click stress, you can click anxiety, you can click depression, addiction, weight loss, whatever you're dealing with. You click that and it'll give you a list of things, and you click on the one that you feel most applies to you, and it'll play that in your headset, and it's kind of like a reset. It just calms you down. And so I was using Brain Tap for myself. I use it in between clients now. I have some clients that are very, very anxious, and that triggers my anxiety. So in between clients, I need a Brain Tap for about 15, 20 minutes to just reset that nervous system. Doing a 20-minute Brain Tap is like taking a 4-hour nap. It's like taking a 2-hour walk in the park. So it just resets things. I've been using it with some of my clients who are really anxious. I'm trialing it out right now with my client that has breast cancer to help her release some of that fear and some of that trauma so that she can heal. But I've also used it with a client who was trying to get pregnant. and was dealing with a lot of emotional things from her childhood, such as abuse, you mentioned, Sweet Tea. And so we're just kind of working through some of the trauma as we are going through things, as we're getting these diagnoses, as we are trying to heal.
And that's what I love. Whenever you are healed from anything, right? You've overcome it or the symptoms leave. Okay. The most important thing is how are you going to deal with the next level of stress in your life? Because how you deal with that next level of stress is going to determine what chemicals are being released in your body, what chemicals lay dormant, right? What knocks your body off balance, and now you're experiencing something different. So it really all goes back to how do you deal with stress? How
Yes.
do you deal with stress?
Self-care, managing
How
that stress, that daily stress, those
how do you deal with it?
field schedules. Um, absolutely. I think that's very important. And
Yes.
managing that is number one. Like you talked about before, Amber,
Yes.
us not putting in the work for ourselves and showing up for ourselves and then just running on fumes. So yeah, absolutely.
Wow.
I agree.
We're gonna have to put together a
Yes.
holistic something for people to learn how to deal with stress. I don't know, maybe a vacation, so a
A
getaway,
retreat. A retreat. I
a
love
retreat.
retreats. Yes. So the higher your stress level is,
Yes.
the more self-care you need and the more frequent you need it.
Say it
So
again.
women
Daily.
such as myself and you all, we are healers. We're thought
Yes.
leaders. We take
Yes.
care of other people. We
Yes.
have to pour back into ourselves more often, more frequently, and on a higher level. Sweet Tea, you mentioned next level. We need next level self-care. So this is
Right.
not getting your nails done. This
Yes.
is
Right.
not getting your hair done. This is
Mm-hmm.
not that. This is
Mhm.
true self-care and healing.
Mhm.
Again,
Mhm.
talking about those foundational things. Meditation, going for a walk. Another thing about movement, people think, oh, I need to lose weight. Let me go to the gym and work out. Let me do this hardcore workout. Well, I learned while I was working with my functional medicine doctor, he was like, Amber, you need to stop doing that. You need to stop doing all this hardcore working out. That's actually adding stress
Stress.
Stress
to an
to your
already
body.
stressed
Yes.
environment.
Body.
He said, I need you to
Absolutely.
do yoga and
Mhm.
Pilates and go walking.
Absolutely.
And
Relaxing.
that's
Yes.
it. And
Yes.
meditate.
Relaxing.
It
Yes.
Relax.
because of the state that you're in right now. When you come
Mhm.
out of that state, you can go back to doing some of those things. But right now, that's not going to be good
Mhm.
for you. And so a lot of
Right.
people don't know that. We're just
Right.
reaching for what we think is going on.
What
And
do
Mhm.
you
then
think?
I can't
What
tell
do
you
you
how
think?
many diets I've tried, right? So they
Yeah.
all work, right? But for how long? And so,
Right.
I have a client with PCOS whose doctor has her on a keto diet.
Mm.
Mm-hmm.
And unless she's doing 100% clean, dairy-free keto, that's not the best
Anti-inflammatory.
diet for someone with
Right.
PCOS
Right.
because
Mm-hmm.
we
Right.
know that dairy is highly inflammatory, right? And
Mhm.
Yes.
so we need
Yes.
to be on an
Yes.
anti-inflammatory diet.
Diet.
And then we
Yeah.
need to look at her. I usually would do
Mm-hmm.
food sensitivity testing on my clients
Mhm.
before I recommend any kind of diet for them because you could literally be sensitive to apples and avocados, but because your doctor told you to eat apples and avocados, that's what you're eating every day, but you're having bloating and you're having gas and you're like, what's going on? I'm eating healthy, right? So
Right.
again, just
Right.
going back to that customized
Wow.
Mhm.
approach of knowing what's
Mhm.
going on with you and your
Exactly.
body.
Yeah,
Exactly.
and we have gotten away from listening to our bodies,
That's just so
listening
true.
to what our bodies are feeling like when we do certain things. So, like you said, if you're eating something that makes you feel bloated afterwards, we don't really pay attention to that, and we're still eating it because it's good or we like it.
Mhm,
And
mhm.
just getting back to that, paying attention to your body. I think the more you do self-care, like you mentioned, yoga, meditating, walking,
Yes.
all of those things, and you start paying attention to your body, and then you can tell the things that your body don't agree with. Even if you're someone who don't have access to the sensitivity test or the things that
Right.
we offer, like, of course, I always say this: the body is self-healing. We just have to
Yes.
put it in the right environment and input the right things into our body so that it can do
Exactly.
its job.
Exactly.
Yes.
Exactly. And what's so beautiful about the going past self-care of just the superficial, because when you talk about
Mm-hmm.
nails done, okay, you're cute. Hair done, okay, you
Mm-hmm.
cute. Your inside
Mm-hmm.
still toe up, baby. They still tore up.
Yes.
Okay?
Well, the
So
chemicals from that nail,
yeah, but
from that
right, that's
nail
what
Yes.
I'm
shop,
saying. That's
that
and that's right.
contributed to the dysfunction that you got going
That's
on in
right.
your
That's
body.
right. But what I'm saying is
Yes.
it's
Yeah,
superficial. It's on the outside. You still have things going on the inside. And what
right.
really helped me starting off was just the breathing aspect. I mean, deep
Yes.
breathing does
Mhm,
so much for your
mhm.
body. I mean, it
Yes.
really enhances like lymphatic drainage. It helps your immune
Yes.
system.
Right.
It helps
Yes.
reduce cortisol and regulate
Yes.
your thyroid. It improves
Yes.
oxygen, right? You're
Yeah.
inhaling, like really expanding your lungs, taking a moment.
Mhm.
Like we breathe so incorrectly throughout the day. Like we're
Yes.
just all messed up with that.
Very
And
shallow.
very
Yeah.
shallow. And then when
Yeah.
something happens, we have the hyperventilation. We're
Yes.
really
Mhm,
off, right? So you
mhm.
have
Yes.
this whole chemical imbalance going on. So the self-care can start with something as simple as deep breathing. That's what taught me in this
Yes.
situation. Like, girl, did your pain just leave from you breathing? I
Right.
couldn't
Mm-hmm.
believe
Right.
it. Because
Yes.
why could nobody tell me to
It
do that?
wasn't it wasn't getting enough oxygen. We don't deep breathe enough. And deep breathing alone can add so much healing to your
Oh my
Yes.
body,
gosh.
Yes.
especially for someone who's trying to get pregnant or pregnant. I teach
Mhm.
breathing exercises as a Lamaze educator.
Wow.
We teach breathing for pregnant women in
Right.
labor and
Right.
childbirth.
Yeah.
You have to breathe,
Breathe.
right?
Yeah.
And so
Hmm.
I'm teaching that all throughout the pregnancy, all even after
Mhm.
birth, the deep breathing aspect of things.
Hmm.
Anytime someone is about to inflict pain on you, what do they
Hmm.
say?
Take a deep breath.
You at the
Take a deep
dentist's
breath.
office.
Right. Right.
They're
Hmm.
about to, you're about to get a root canal. What are they gonna say?
Hmm.
Yeah, take a
Yeah.
deep breath,
Take a deep
right?
breath.
So
Take a deep breath.
breathing is so important because that's how we oxygenate our body.
Hmm.
That's how we oxygenate our cells. And the
Yes.
Yes.
healing really starts at the cellular level. So I
Mhm.
love that what you said. And Sweet Tea, you were
Yes.
talking about listening to our bodies. That
Yes.
is a form of self-care.
Yes.
That's real self-care. And
Yes.
I have to teach women to listen to their bodies in labor and in birth.
Mhm.
Doctors will put you on your back with your legs wide open. I was in all fours when I was getting ready to push. That's what my
Mhm.
body told me to do, and that's what I
Right.
did. You have to
Yeah.
Right.
listen to your body.
Yep.
Your body knows what it's doing and it knows what it
Yeah.
needs.
Yeah.
Mhm.
Pain is usually a sign of something that needs attention. If you have
Yeah.
a
Mhm.
headache, either you're dehydrated, you have a sinus infection, you need sleep, or you're hungry. For me, most of the
Something
time,
going.
I'm hungry. But but if pain is a sign that there's something out of balance that needs
Right.
to be restored, that
Address.
needs your
Mhm.
attention, right?
Mhm.
Hmm.
And so
Hmm.
we have to listen to our bodies. That's like number one form of self-care. For
Mhm.
me,
Hmm.
boundaries was something
Ooh.
I discovered was a big issue for me in
Ooh.
my self-care. And it's
Yeah.
not, I'm good at telling outsiders no. It was the
Hmm.
Uh-huh.
people that's close to me, my
I got
husband,
you.
my
Yeah.
daughter, my mom,
Mhm.
not realizing these people was stressing me out. And
And they
wasn't
don't
them.
know.
It was
Right.
Don't
me
know.
Right.
Yes.
going above and
And
beyond,
beyond.
Mhm.
going above and
Mhm.
beyond, doing too much, answering
Yep.
every beck and call, every text message,
Yes.
being
Yes.
present at every basketball game, like
Yes.
super
Yes.
mom. No,
Yes.
Right.
Yep.
Right.
That's it.
Right.
That's
say
Right.
it.
no. That is a good form of self-care. So we could
It's
have a
healthy.
whole session on true
Self-care.
self-care.
Yes.
Yes.
Yeah.
It's
Grounding
healthy.
is another natural way. Free. Go outside, walk in the grass, no shoes. Let your
Yes.
body
Yes.
ground,
Bring
balance out,
yeah,
and
the balance. Oh, yeah.
yes, and it has so many
That's my
benefits.
favorite thing. That's
So
my
many
Oh,
favorite.
benefits. Yeah,
Grounding.
oh
That
gosh.
has
absolutely.
been so essential and healing for me. And
Mhm.
grounding
Mhm.
Mhm.
reduces inflammation. And
Absolutely.
it's
Mhm.
something about being connected to the components of the earth, right?
Mhm.
Yes. Yes.
that is healing for us. If you think about it, we are so connected to the earth. Like they say the earth is like 70-80% water, right? The world. What do they say about our bodies? 70,
Same.
80%
70,
water, 70,
80%
80%
water,
water.
right?
Mm-hmm.
And then if you think about let's think about root cause blood work analysis. One of the things that I see that's off a lot for my clients is their iron. Iron deficiency anemia.
Mm-hmm.
Where's iron at? It's out here in the world, right? It's part of the
Yeah.
earth.
Yeah.
We
Yeah.
Right.
are part of the earth. Like, if you don't
Yes.
believe we were made for the earth, from the earth,
Yes.
just look at the elements. Like, we're
Mm-hmm. Mm-hmm.
Right.
composed of the same things, you know?
Right.
When you look at that blood
Mm-hmm.
work, we see elements in there. We see
Mm-hmm.
things like phosphorus. We see things like
Right.
sodium. We see iron. We see these are elements of the earth.
Yes. Yes.
And we
I
have
love
to keep those things in balance.
I
You
love it.
cannot grow a healthy baby if your iron is low. And I have clients that are on Clomid, they're doing IVF, and their iron is low.
So nothing's gonna work regardless if you don't correct the root cause. You
Wow.
know, the root issue, the root problem of
Right.
what's happening in your body. So yeah, you're so
Exactly.
right, Amber.
That
So
is.
right. You're
Right.
right on point. We like you talked about the soil. We are plants. We need to treat ourselves as such, and you wouldn't give your plant some of the things that you eat, some of the processed foods, some of the
Right.
bad things. So eating
Mm-hmm.
more natural, healthy
Mm-hmm.
vegetables, fruits, water, those
Yeah.
types of things to nourish
Yeah.
your body, giving your
Right.
body the things it needs to be in that environment that I spoke about, that it can self heal, that you
Right.
can correct those things on your own with putting
Yeah.
those things into your body. So absolutely, Amber, you are right on track.
Right
And
on track. Right
yeah,
on track.
I'm so happy that you were able to come share your knowledge here
Yes,
with
this
us
has been
today.
amazing.
Yeah, this is so amazing, and I am so excited to share this space with you, and that you were able to give us the points that you gave today, which are
Yes.
so many good points. I'm gonna have to go back and
Yes.
rewatch this
Me
myself.
too.
Amber, you were on point today. I really appreciate you. And I just want to say to everyone, or every mom listening, just know that you are not broken, you are not weak, and you are not alone. There are
No.
people here to help you, help guide you, whether it's infertility, maintaining that pregnancy,
Yes.
postpartum care, or even breastfeeding. Amber, you are a specialist with that as well, right? I think
Yes.
yeah, she's lagging a little bit. That's
Yeah.
okay. But yeah, she definitely has experience with that. Mothers are the heartbeat of the home, and when we
Yes.
heal the mother, we heal the whole house, right?
Exactly.
Because you are
Exactly.
the foundation. We are the foundation of
Yeah.
our family. So I am so glad that
Me
we had this
too.
conversation today.
So full. I'm
Amber,
so
how do
full.
people reach you? How can they get in touch with you? Can she hear me? I don't think so. I think she's frozen.
Can you hear Amber?
Am I frozen?
Okay. You're
Okay.
Yes.
you're
You're
coming back.
back.
You're coming back.
Y'all can't hear
Yeah,
me?
We can hear
I can
you.
hear you. I was saying, tell the people how they can reach you, how to reach out to you for your services.
Yes, we do have a website at www.mothereavescss.com, which stands for Childbearing Support Services. And then our Instagram is at mothereavescss.com. And then we also have a Facebook page, Mother Eve's Childbearing Support Services.com. Or Facebook.
Yes.
So we can be reached on those forms.
All right.
All right. Well, that is
Thanks, Amber.
amazing. Thank you guys for being here today. This is gonna wrap up our
So
Chanel
full.
Love 22 podcast. Bloodwork bestie Latoya and
Yes.
Amber. Thank you, Amber, for all your knowledge today. Latoya, do you have any thing you want to throw out there, or any way?
Absolutely. Let me just leave with the people for today. Okay. We talked so much today about your body and your mind and the soil. And that is really sticking with me. The soil. So the soil also includes the people who are around you. Okay.
Yeah,
The energy that
absolutely.
you keep around you, the
Yes.
conversations that you engage in. And
Mm-hmm.
you know, when the phone rings and that is someone who's going to bring some dusty dirt to your good soil, it's okay for you not to answer that phone, okay? Because you are protecting your soil so that you can grow, right? In ways that you have desires and goals and dreams, and they're just not meeting you at that point. It's not good fertilizer for your soil. So that's
Right.
incorporated in that as well. So, make sure that you're keeping the energy around you just as pure as you are, and so that you can continue on the journey that you feel you are destined to do. Thank you,
Right.
Amber.
Right.
Thank you.
All right. Well, we are out of here. Stay tuned for the next live. Of course, we'll post something and let you guys know when that'll be. But until then, have a good one.
Bye.
Bye. Chanel Love 22. It's a vibe. Like, follow, and subscribe.
Disclaimer. The information shared on the Chanel Love 22 podcast is for educational and entertainment purposes only and is not medical advice. Neither the host, guest, nor the podcast assumes responsibility for any actions taken based on this content. Listeners are strongly encouraged to consult a licensed healthcare provider before making any changes to their health, including medications, supplements, or treatments. This podcast is intended to comply with applicable regulations. However, it is not a substitute for legal or medical advice specific to your location. Listeners outside of the United States should ensure they follow healthcare guidance and regulations relevant to their regions. Thank you for listening, and remember, health is wealth.